Welcome
Great.
everyone to tonight's national peer-to-peer webinar titled Removing Known Barriers to Mealtime Insulin Dosing. We of course are excited to have you tonight and we appreciate your attendance. My name is Chris Garcia and I am from the CeQur marketing team. I do see some familiar names out there, so good to see you all and thanks for joining. So before I present today's agenda and introduce our speaker for tonight officially, I'd like to cover a few housekeeping items. Just a friendly reminder, all attendees are muted throughout the entirety of tonight's presentation. However, of course, you're welcome to type in any questions that you may have in either the chat box or the Q&A box. My colleague, Curtis Carter, is behind the scenes there, available and ready to answer your questions. And we will also make sure to answer any additional questions during the Q&A session after Dr. Hirsch's presentation. So great, let us get started. And next slide, please, Dr. Hirsch. You may need to click on any, there you go. So here are the discussion items for today's presentation. So first, we'll cover the unmet need and insulin delivery. Next, we will cover CeQur Simplicity's features and benefits. Followed by that, we will cover our clinical data, user satisfaction data, and what we're most excited about tonight is new content, which is a patient case study with before and after CGM reports. And lastly, we will cover a brief summary, which will then be followed by the Q&A session. Next slide, please, Dr. Hirsch. I'd like to now take the time to introduce you to our esteemed speaker for tonight, Dr. Barbara Hirsch. She is an endocrinologist and partner at North Shore Diabetes and Endocrine Associates Prime. Dr. Hirsch is a clinical assistant professor in the Department of Medicine at the Barbara Zucker School of Medicine at Hofstra North Shore Northwell. She attended SUNY Buffalo School of Medicine, completed an internal medicine internship at Long Island Jewish Hospital, an internal medicine residency program at Mount Sinai Hospital, and a fellowship in endocrinology at Albert Einstein College of Medicine. She holds an MS in narrative medicine from Columbia University. Dr. Hirsch is board certified in the areas of internal medicine, as well as endocrinology and metabolism. Next slide, please, Dr. Hirsch. So before I hand it over to Dr. Hirsch to take us through the slides, I'd like to remind everyone that this program is sponsored by CeQur and the speaker is presenting on behalf of CeQur. So Dr. Hirsch, thank you again for partnering with us for tonight's presentation. I'd like to hand it over to you now to kick us off with the first section, the unmet need and insulin delivery. Thank you.
It's my pleasure to be here and talk to you tonight about the unmet need in insulin delivery and tell you how CeQur can help us with that issue. So what's the problem? What's the challenge? We know that insulin works. Obviously, it's been around. It's one of the oldest diabetes therapies we have. But obviously, it needs to be dosed consistently. About 30 million people have diabetes in the United States, and 5 million of those folks are on insulin. We have almost a century of data to support the use of insulin. It is one of the most effective ways to lower glycohemoglobin, even with some of the newer therapies that have become available to us in recent times. Now, if you look at the 5 million, you then may say to yourself, well, how many people are taking insulin with their meals? And it's really only half of them. And the intensification of insulin therapy with mealtime dosing has been proven to help people with diabetes achieve glycemic targets. But still in all, people are struggling to get to the glycohemoglobin less than 7, which has been advocated by the American Diabetes Association. What's the problem here? The problem here is that many patients are not taking the multiple daily mealtime injections that they need to take. And why is that? There's a whole bunch of things, and I think it's really important to go over these individually so we understand what our challenge is. One, probably the most basic, 72% of folks do not take insulin outside of their home for whatever reason. Maybe they're embarrassed. Maybe it interferes with their daily activities. 57% said, you know, I just forgot to take that shot. 53% forgot to dose the right amount, 40% forgot their insulin, and 33% skipped on purpose. And we could all make up a whole bunch of reasons of why that is. People are afraid, you know, they're embarrassed, or they don't want to take an extra thing with them when they leave the house. But with all of this, missing an insulin dose raises the glycohemoglobin with an increased risk of diabetes complications and the cost of care. So why is that? Because we all know that the need for everybody with diabetes is basal bolus, that we have a need for insulin overnight in the basal state, but we do spend 12 hours of every day in the postprandial state. So if we don't have something covering those meals, we're going to raise our glycohemoglobin almost a point, 0.92. So for every 4 missed mealtime doses per week, there's a point that we lose in glycohemoglobin, and we have a deterioration in control. So that's where CeQur comes in. The CeQur Simplicity on-demand insulin delivery system is intended for subcutaneous bolus delivery of insulin for the management of diabetes mellitus in adult persons requiring insulin. The CeQur Simplicity on-demand insulin delivery system has been studied for use in adult persons over the age of 21 with diabetes. It is not intended in pediatric use. It is labeled for use with Humalog U100 and Novolog U100. The insulin is sold separately. Now let's look a little more carefully. What is this? I can't see you guys, but hopefully you can see me. I am holding up the CeQur device, and you're going to see pictures of it as you see it now. So there's a critical need for insulin regimens that are less burdensome. I'm going to sort of enhance that whole sentence by saying this. I have found over the decades that I have taken care of people with this chronic disease, diabetes mellitus, this is a very different kind of clinical care than being in an ER or being in an ICU, where it's one and done in terms of therapy. When we are chronic care providers, it is up to us to keep searching for ways that are going to help our patients take care of a complicated process, make it as easy for them as possible so that they can take better care of themselves. And that's what we're finding with CeQur. This is a convenient device that fits into the lives of people requiring mealtime insulin. It's wearable while showering, sleeping, exercising, and swimming. It's designed for ease of use. It's discreet. It is worn and dosed under clothing, compact design. It's very tiny, 65 by 36 millimeters, lightweight, and thin. There's less embarrassment when patients can give themselves insulin while not having to go to the bathroom or, you know, start with a pen at a dinner table, et cetera, et cetera. So that leads to better adherence. The more we make it discreet and easy, the more compliance we're going to have. And let's not forget that this is an injection-free dosing. There are fewer injections. One device enables us to give 9 mealtime injections. So there's less pain. 90% of users reported mealtime insulin painless with CeQur Simplicity. So 9 out of 10 users claim that CeQur Simplicity helped them to do a better job following their insulin regimen than using an insulin syringe or a pen. Okay, let's take a little deeper dive. Here it is. The CeQur Simplicity delivers a 2-unit dose with every squeeze of the buttons that you see at the top. The small flexible cannula is available for the insulin delivery. The low profile, less than 4 stack quarters thick, it's tiny. The soft corners are for comfort. There's no edge digging into your patient's skin. It's water resistant and stays on through bathing, exercise, intimacy, and sleep. Again, really important to make this adaptable to our patient's lifestyle. The CeQur Simplicity holds up to 200 units of rapidly acting insulin with a minimum fill of 100 units. There is a bolus-only patch, complements existing basal insulin therapy. So this can go anywhere with them. Why is this? Okay. So let's take a little bit better look at what I mean by how we're going to eliminate injections. Let's compare 3 days of life in a patient who's taking MDI, multiple daily injections, including basal and bolus injections. So basically, we have a contrast here of syringes, pens, and the CeQur Simplicity. The syringes, we all know, we've been seeing them for decades. If you want to take an injection in 3 days, that's 9 injections, could actually be 12 if you're going to count the basal shot as well. So per year, that's 1,095 bolus doses. And the same thing with the pens. Here's 9 pen needles stacked up, and this is only bolus dosing. Okay. Whereas here you see the Simplicity, the CeQur Simplicity, 1 insertion, 122 in a year to deliver all that mealtime insulin. Okay, and the unique FDA classification product code. This is not a pump. This is a patch. It is a bolus-only patch. It is the first in class as such. And you can see if you go through the product class, the complement to long-acting insulin, the 3-day wearable, the discrete dosing, the injection-free delivery, and you can see that really CeQur Simplicity checks off all the boxes. Check, that we're able to complement long-acting insulin. We have a simple, low-cost transition, 3 days of wear, discrete dosing. People can be sitting anywhere and give themselves insulin with nobody else aware of that. Injection-free delivery, no pain, no carrying around a pen, and the capacity for type 2 diabetes. You can see some of these other methods that is not a possibility. So let's talk about some of the clinical data. Okay, first we're going to talk about my patient. Okay, so this is a patient of mine who I've known for a very long time. He's a man about 77 years of age. And for years, he was type 2. I had him on a bunch of things. He was on metformin, he was on an SGLT2, he was on a sulf. The Novolog and Toujeo came later, I'll explain in a sec, and he was on a GLP. And I had explained to him for years that he was sort of on the max of type 2 therapy. And, you know, I didn't know how long that would last. He was what I like to call a type 1.5. So he was using finger sticks, and then I had encouraged him. One time we were trying to assess where he was at, that he should put on a Libre Pro. So I'm going to jump to the bottom part of the slide because that's really sort of where the story begins. The story begins as that he went for a TAVR rather, and after the TAVR, his control really unraveled. He lost a lot of weight. And his cardiologist sent him back to me. And at that point, he had a glyco of 8.77. He had always been in the high 6s, had done pretty well. And his time in range on the CGM was 49%. So it was at this point that we sort of got rid of the GLPs because of the issue of the weight loss. And we really wanted to just move along. And we got into using long and short-acting insulin. And this is his baseline, so to speak, CGM report that I did before he went on CeQur. You can see the CGM is active 100% of the time. For those of you who have not looked at a lot of Libre View, I'm just going to walk you through that. Basically, the Libre View allows us to see those in target, which is a pretty broad target, 70 to 180, high 181 to 250, very high, greater than 250, and low as well. And here you can see he was in target about 49% of the time, high a quarter of the time, very high a quarter of the time. Okay, the other terms on the left, there's sort of a prediction of the glycohemoglobin, which here was about 8.1. So we said, you know what, we got to do something different. We're not doing all that well. And you can see here, one of the things I love about reviewing patients' CGM, which I do in the office with them all the time, I try to show them their patterns. And if you have a look at this, if you look at between midnight and 6 a.m. in those individuals who don't work nights, for the most part, that'll show you what's going on with their basal insulin. And then if you look at the rest of the graph during the day, that will show you whether they need bolus insulin, and if they're on bolus insulin, how they're doing. And you can see he's doing not particularly well here. All those yellow, spikes up, that's all hyperglycemia and going, going towards and touching 350. So we knew he had to do something, and we wanted to proceed. So backing up on the published data, there's been quite a lot of published data that we have with CeQur, and there's functional testing that concluded that the patch was safe. This was published in 2018. There's user experience studies, which include the studies detailed here, Payroad, Zraick, and basically both said users rated higher satisfaction with more frequent dosing than pen or syringe, and some randomized control trials, both the Bohannon and the Bergen style, which showed you clinically proven to reduce glyco and increase time in range. And I'm just going to share some of that data with you. This happens to be the Bergenstall study, which was, sort of your classic multi-centered random trial where patients were experienced both pen and patch in a crossover study, about 300 folks. These were all type 2 patients who had been on basal insulin only, their glycos in the range of 7.5 to 11, and their ages 22 to 75. They had been looking at logbooks and simple insulin adjustment algorithms. The primary endpoint that was sought out here was the change in glyco at 24 weeks. The secondary was, what did the patients say about their experience? How did they experience what they went through? And if you want to look at the demographics of the patients, we see here, basically they're very well matched. Duration of diabetes, about 15 years in the groups. Their weights, you can see here. Their glycohemoglobins pretty much well matched up at the 8.6 mark. And you can see that the CeQur patients match the pen patients, so they're pretty well delineated. And here we can see the results of what happened. In terms of getting to goal, 63% of patients got to a glyco of less than 7 at 24 weeks, 85% got to less than 8 at week 24, a change in glycohemoglobin of 1.7. So what we saw in this trial is that there was non-inferiority, that both the pen and the CeQur were able to get patients to goal. And here you can see it again. What happened to the glycohemoglobin over goal over time is that CeQur did as well as the injections, that the non-inferior endpoint was met at week 24. But let's look now at the time in range, which I showed you about my patient, and let's look at what happened with CeQur. And basically you can see the change at week 24 that patients on CeQur got to 74% of time in range versus 75 with the pens, the 71 to 180 that I pointed out earlier with my patient. And the glycohemoglobin, both groups got to a reasonable glycohemoglobins, 6.8, 6.7. But now let's look at the time in range a little more closely. You can see here at week 24, that's 74% time in range. It's interesting because this data, obviously you can see, well, you haven't seen my patient yet, but he started out at 48% as well, and you're going to see where he ended up. What about adverse events? I mean, obviously every trial's got to report that. And basically, if you scan up and down, there aren't really much related to that. They're related to the device, the study conduct, there really isn't much, going on here. Nothing much in terms of difference with the hypoglycemia. But really, here's what we really want to focus on, because I said to you when I started talking a while ago that really it's our job and our responsibility to make experiences for patients taking care of themselves as easy as possible so they can be compliant. So let's look at the experience of what happened here prior to Simplicity versus with Simplicity. With Simplicity, the insulin, the satisfaction goes from 293 to 425. Interference with activities, much less, 2.5 to 179. The outcomes, that higher is better. The diabetes-related worry goes down. The psychological well-being. Every time we give patients something better, that's something we really, because, this is a ping pong. The better patients are feeling about themselves, the better their sugars are, the better they're feeling with their own little report card. when they get a glyco from the doctor, that's their report card. So they feel better when they're doing better. And if you look at this data here, you can see that not at all satisfied, somewhat, very, completely satisfied. 94% of patients are completely or very satisfied with Simplicity with the CeQur device compared to 35% with their prior methods. And 93% of patients say Simplicity is better than their previous methods. So I would say here that this is what's going to lead us to patient satisfaction, and offering this alternative allows patients to get done what they want to get done and get their sugars taken care of. So why should we use CeQur Simplicity? Because our patients need help with PPGs. They not only they want an alternative to pens, they don't want to be taking the pens out of the house. They're interested in something discreet, so they don't, everyone in the room doesn't need to know they're taking out a pen and taking insulin. So in this particular case, the CeQur Simplicity was presented by the healthcare professional, aka me, and the patient was started on CeQur on 11/1/22. The patient used Freestyle Libre Pro for 1 week in February 2023, so we can look at a contrast. And here you see the difference. I actually did slightly better than the study, or this patient did. He ends up being 88% time in range with the use of the CeQur Simplicity. And I think what you're going to see here is absolutely stunning, that most of those high yellow peaks of post-meal sugar are gone. So we achieved what we wanted to. He wore the Libre Pro for 1 week. He's had less prandial spikes, and his time in range has increased dramatically to 88%. I have to say, since the write-up of this case, this patient now is wearing Libre all the time because he saw, the benefit of doing this after we did this. Okay, so the glyco was lowered from 877 to 731. Time in range went from 49 to 88, pretty similar to what we saw in the study, actually even better. The baseline CGM, the patient used Freestyle Libre for 2 weeks and followed that up, and now is a Freestyle Libre wearer as well. He was able to dose insulin discreetly outside of his home, which he described this very, he said, I'm a very social guy, Dr. Hirsch. And, I really was reluctant to start taking insulin outside of the home. And now when I go out with friends, it's just click, click, nobody knows what I'm doing. So he doesn't need to go to a restroom to take his insulin. He's actually put on a few pounds. He's modified his insulin, and he's very satisfied. And he likes this feedback between taking different doses of insulin, seeing how he's doing with his CGM. So he's really enjoying taking control of his life in this way and sort of seeing what happens. He eats this food, he takes this amount of insulin, he sees the feedback with the device. So he's really enjoying his autonomy. So in summary, the prescription includes the patches, the quick start guide, and these, I would advise everybody who's interested actually to take a picture of this slide so you have the NDC code. You're going to then prescribe the inserter as well. You prescribe a vial of reactively active insulin, that's a separate thing. So the CeQur, again, is labeled for use with Humalog U100 or Novolog U100. And have the patients call to have some instruction if that's not going to happen in your office. But again, I would advise taking a picture of this slide so you're able to have this ready, available to you. So in summary, we're looking to simplify the lives of people with diabetes. It's a complicated process, and the more tools we give people, I think the better it's going to be for them to be compliant and feel their autonomy. Missing mealtime insulin doses, we know can lead to poor glucose control, so we're happy to have an opportunity for them to take better care of themselves. CeQur Simplicity can address barriers to mealtime insulin dosing, such as the discrete use of the product, without having to reach for a pen or a syringe. We have seen both in our studies and my personal experience of reduction of glycohemoglobin and improvement of time in range. Adherence has shown to reduce all-cause costs. the preferred insulin pens by patients. It's preferred over pens by patients and providers. And CeQur Care and NipRx specialty pharmacy is available to help patients. And this material is intended for healthcare professionals. And I think that is the last slide. I'm going to stop sharing, and I'd love to take your questions. And thank you very much for your time.